this is my disclosure, and again, please note that I am partially involved in this presentation with some development I did for the companies that you are seeing now listed, because the topic is reversing the bearing surfaces in reverse shoulder arthroplasty. As we all know, the Grammont design is a semi-constraint. It is solving the problem of the soft tissue impairment, the rotator cuff missing, and it is working biomechanically with the medialization of the center of rotation and improving the deltoid lever arm. However, through the years, although this is a great idea that Paul Grammont had, we had the impingement and the notching, the instability, and the range of motion, as we have seen also in my previous presentation. This is why the engineers plus the surgeon in the last decades or so are working very much about some ideas that may eventually solve these issues that are open after the excellent results we were getting with the Grammont design, if we can even make it better. So recentering the center of rotation with the positioning of the metaglane, the glenosphere design, the neck augments, the rotation of the humeral components, the liner configuration in lay on lay, and constraint more or less, and of course tribology. The tribology effect is quite relevant. Richard Niffler, a great doctor and engineer, demonstrated this very clearly years ago, that the interaction of the materials, including metal, polyethylene, and bone, of course, that is a sort of material, may eventually lead to the polywear. So this is why, not many years ago, but I participated in this project of reversing the materials, designing a glenosphere that is in polyethylene, and the liner instead could be in ceramic or chrome cobalt. This is preventing the possibility of dead space behind, because everything is filled with the polyethylene on the glenosphere. You may have a concentric-eccentric design and larger diameter, ranging from 40, one model, or 44. Why this thinking? We did our experiments in the lab, and we understood that with the larger diameter and with some concentric design, as you can see here, you may prevent impinging under the glenoid, also getting some little, as you will see later, little lateralization with the design. So you see this is on the left, it is a 36 concentrics, and here it is the 44 concentric design that is helping in preventing this issue. But what is even more important to me is that we did some tests with millions of cycles, exactly 3 million with the machine in the lab, and we could demonstrate that the polywear generation of the friction could be reduced with this new kind of coupling of the materials by 23% after 3 million of cycles and testing the wear of the surfaces. 23. Which are the effects on the biomechanics of a reverse shoulder arthroplasty? Number one, possibly it is the liner effect, and of course offset is important, increasing the rotator's moment with higher impingement-free AB adduction. The neck shaft angle that we are moving now from 155 to 140, 145, 135 in some design. Higher is the shaft angle, higher is the risk of notching, lower, less AB adduction. So it is a trade-off. You can pay from one side to another one. And then the depth can be shallow, the liner, I'm speaking about the liner, with more mobility, or deep with more stability but possible increase of the shear forces over the implant. The version effect also plays a role, and this may have a great influence in daily life and eventually in the impingement, including anterior and posterior impingement. So if you place neutral rotation or -20, you may have better AB adduction external rotation, but in some cases you are missing internal rotation that is very important for personal hygiene, for instance. But also the glenosphere not only liner, or the version are playing a role in the function. Eccentricity can be helping preventing these negative effects like notching, and augments of the neck can also help in this direction, like the bio-RSA or a thicker base plate that it is lateralizing. This is what we did with this design, and this is a study I published a few years ago comparing a standard 36 versus a 44 all-poly glenosphere that is lateralized in 4 millimeters. And you see here in yellow the 44 concentric, the range of motion both in flexion, external rotation and internal rotation is performing better. So what are the unmet clinical needs when we are talking about all these detailed issues? Notching was happening in reverse shoulder implants. Due to this, regular design will produce more poly debris than with possible complication. And what happens to an implant that doesn't produce poly debris caused by notching? This is the question mark. And this is why we reached the idea of reversing the bearing surface as I described. And this is a study that I did observing this. The study endpoints is the primary is to evaluate the performance of this inverted bearing reverse total shoulder, and the secondary is to compare the clinical and radiographic outcomes with previously published result of the same implant in terms of base plate and stem that I published with some co-workers here, so I could compare the 36 eccentric and the all poly glenosphere with the same rest of the implant. So it is like a tripled group of control. These are the materials of the study, and you see here that these are 39 shoulder, the age, blah 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 blah, and the diagnosis, Hamada 4, it was the great vast majority, just a few Hamada 4A, and Hamada 5, 3%. We evaluated the constant score, the American shoulder and elbow, and we evaluated X-rays with 5 different time frames: pre-op time 0, at 3 months time 2, at 6 months time 3, and so on up to 2 years, that is time 5. And let's see the results. This is the old polyglenosphere, and the other study, I was part of these studies too, but I put different names in order to prevent any confusion, comparing time 0 and time 5. You can tell that time 0 to time 5, the increase that I get because the cases I was treating in this group was very bad, starting from 21 of constant, reaching 58. And the other two groups are very close, but starting with better starting point. This is the forward flexion and external rotation, exactly the same, and you can see that forward flexion is improving quite a lot, and of course also external rotation. See here that you can get good results. But what is the most important to me is notching. I did not observe, because the other results can be similar somehow, although a little better. You see that notching, I observed this, that I had 0. 0.1 is because the computer is not accepting for the graphs to have complete 0, but it was 0. I did not observe any notching in this study compared to the others who were provoking and inducing very little, but anyways, some notching. Complication, we had one dislocation, 2.6% at 3 weeks, and then we did a humeral body extension. And also in the other groups that I use a control, I had 3 dislocation in one group and 2 dislocation in the other. It means that we achieve even a better stability of the system. And as a conclusion of this study, the results that we achieve is that this design demonstrated a faster and more stable functional recovery, lower notching, that is important, and lower instability with respect to the standard metal concentric design. And so again, some fantasy sometimes may help, and this is exactly what you see when you have a standard metal glenosphere, the all poly, and this funny aspect of X-rays with reversing biomaterial. Thank you again. I take the opportunity, this is my last presentation, to thank very much all the friends of SLAHOC and the big friends I have in Ecuador, I'm sorry I cannot be there, but anyways, thank you, Byron, thank you, Juan Valles, and also my dear friend, Dr. Victor Naula. I wish all of you great luck in your life, and I'm waiting for you in Rome for 2023 World Congress. If somebody wants my Smile Live experience in February 22, and of course the European Shoulder and Elbow, that is always very, very high level and interesting. Thank you, muchísimas gracias, and hasta pronto.